Good evening, everyone. Thank you for joining me tonight on Gut Over It. My name is Dr. Vivian Asamoah. I am a gastroenterologist in Katy, Texas. I'm also a functional medicine provider, and I thank everyone for joining me tonight. We are going to be talking about everything about milk and the controversies around milk. So if you're joining us live or you're on the replay, please enjoy the replay. Please go ahead and give us some likes, share some love, leave some comments. And tonight's comment is going to be got milk. It has to be got milk. So definitely leave some comments for us. I'm glad to see everyone joining in. I'm just going to wait a couple minutes for everyone to log on and stream on, because this is going to be 10 to 15 minutes of really great information. I learned a lot actually working on this topic today. So I'm sure there'll be some great questions, and I welcome suggestions about topics we could have next week. I've got a couple. So people want to hear about candida overgrowth, which is really important. They also want to hear about bacterial overgrowth, probiotics, which are the best probiotics to use. So we will get to all of that, because in the month of February, I've set myself a personal challenge. It's one of those challenges, you kind of use, it's kind of a fear that you have or something you've never done before, and you want to be able to get into it, do it well, and at the same time provide great education to people out there, especially my patients. So this is a personal challenge of mine. So I see a couple people on, and I see a couple people giving me some shout outs. So we are going to go ahead and get started. I'm just going to make sure everyone can hear me, everyone's logged on fine, and everyone can actually see everything. Great. So the big question that I think there's a lot of controversy here, but the big question is really, should we drink milk? And when we say milk, I mean cow's milk, right? So there's a lot of information out there, and I have a lot of great information to share. And one of the questions that always comes up as I was doing the literature is why are we as humans not able to wean off other mammals' breast milk? Why are we still drinking the milk that cows should be drinking, that was intended for cows to drink? And I think this kind of revolves around a movement, the got milk movement that started a while back, about how milk is extremely helpful, basically for healthy nutrition, to grow strong bones and strong children. And so it was incorporated into schools. The milk cartons came out in the 60s, 70s, and there was milk everywhere. It was the land of milk. And, today, when you ask a lot of people, why do you drink milk? First and foremost, I think people love the way it tastes, right? And we'll go into that. And then some people say, well, what do you want me to put in my cereal? And I'm like, why do you eat cereal? Cereal is just a processed cardboard, wheat, factory thing that, so that's the next question. Why? And then other people say, well, where am I going to get my vitamin D and my calcium from, Dr. V? It's all in milk. Like, where else? I'm going to be deficient. And go figure. Everyone is drinking milk, but everyone is vitamin D deficient. I know I am. I drink milk. So what's going on? There is a Swedish guy. He's also a friend. He's a new friend. He wrote a great paper. And this is a landmark paper, because it actually showed that the countries that have the highest dairy intake are the countries that actually have the highest rate of osteoporosis and bone fracture. So, I don't really want to get in controversies. I'm not a political person. I don't want to, I'm new on Facebook. I don't want to say anything where like Facebook kicks me out or anything like that. But when you read the data and you read the literature, the whole propaganda and movement about milk kind of stem from maybe some financial gain by people who were providing the guidelines, but also had some financial gain with the milk industry, the dairy industry. That's what I read. I have no proof. I was not there. I have no fact. Facebook, please don't kick me out. but that is what I read. So, there's a lot of there are reports that are coming out, groups are actually doing a lot of research, and we're not seeing the benefit. But anyway, so maybe there was some kind of misconception, but my goodness, when you brainwash someone and brainwash children especially, and brainwash parents to thinking that milk is a must, your kid is going to grow strong healthy bones, we feel like we need to give milk. So the recommendation back then was adults should be drinking 3 cups of milk a day, and children of school age should be drinking 2 cups of milk a day. And so I looked at the data, and there is actually 39 grams of sugar in 3 cups of milk and 26 grams of sugar in 2 cups of milk, honestly. And milk only has 3.3% of protein in it. It's a great source of calcium, but it's also rich in cholesterol. So then that kind of took me back to another well-known cereal where they say, oh, it lowers your cholesterol, it's high in fiber. You put the milk in there, you got a lot of sugar, you got cholesterol. I don't know which one wins, but it doesn't seem that healthy when you start thinking about it. And so dairy is really high in cholesterol, and dairy has been associated with obesity, diabetes, heart disease, a bunch of stuff, from a cardiovascular standpoint. But dairy does have, when I actually looked at the breakdown product of what constitutes milk, 80% of it is casein, which is basically an amino acid, a protein in milk, and 20% of it is whey. And that's where we have the whey shakes and things like that, right? So that is what actually constitutes milk. I think the issue that we have with milk today is that it's not the milk that our grandparents drank. Actually, I don't think my grandparents drank milk. I think they were of that study group that low milk intake, low risk of osteoporosis and fractures, right? But I mean, it just goes to say that the hormones, the genetic modifications, the inflammatory proteins, the growth hormones as well, all of these things, contribute to why the milk has changed and why the milk is affecting us in so many different ways. So there are studies showing an association with cancer, prostate cancer, and ovarian cancer with just pure dairy. Okay, so we'll talk about that a little bit. But as a gastroenterologist, and because this is gut over it, I'm really going to talk about how this ties into what I do in my practice and what I see from patients. And when it comes to milk, how I handle it in our functional gastroenterology practice. So there is milk intolerance, like cow milk protein intolerance, which we hear a lot about in kids, in infants, right? Who, given cow's milk at an early age, or even the formula milk with dairy, will develop a lot of colic, a lot of bloating, even wheezing, eczema, and bloody diarrhea, and generally failure to thrive until you take them off that milk. And then there is lactose intolerance. So they're very different things. Lactose intolerance basically just means that we don't have the enzyme activity to digest milk, to break down the sugar of milk, which is lactose, right? And so every time you consume a dairy product that's high in lactose, typically milk, you will feel bloated, get some abdominal cramping, and have diarrhea shortly after having that food. So I know because my husband is lactose intolerant, and he can tolerate different types of milk. And these people are the ones who reach out for the lactate, which is the enzyme that they actually need to break down the sugars, okay? So when it comes to the first type, it's not only seen in kids, we see it in adults as well. So it's really an inflammatory process that is related to the proteins in milk product, in dairy. And we talk about casein and we talk about whey, but there are so many different forms of casein and whey. There's like alpha casein, alpha 1, alpha 2, alpha 3, so many different forms, and everyone reacts completely differently to them. And with whey doesn't have as much of the inflammatory products, but it does contain immunoglobulins, it contains beta galactans, it contains other proteins that we find in milk as well. But most of the reaction, the inflammatory nature of milk and the reactions that people have is because of the casein itself, okay? So generally, everyone thinks of milk lactose intolerance as something that they're born with, but actually congenital lactose intolerance is extremely rare. Like a baby that is born with lactose intolerance, very, very rare. Most lactose intolerance is acquired over time. So you can get it in your teen years, you can get it in your 40s, you can get it in your 80s. It's acquired over time. And it's acquired some of it is ethnic related. So we know that I think the data was about 75 to 95% of African Americans, Black people, and Asians actually have a much higher rate of lactose intolerance, right? So bloating, cramping, and foul diarrhea will be the symptoms they have when they have dairy. So it depends on ethnic groups. We're seeing a lot more in African Americans and also in Asians. But we see, as a gastroenterologist, I see a lot of lactose intolerance develop when people have small bowel issues. So if someone has Crohn's disease that affects the small bowel, because that's actually where the digestion and the absorption of lactose happens. So small bowel issues, I'll see it a lot in people who have Crohn's disease, celiac disease, yeast overgrowth, dysbiosis, giardia infections, so parasitic infections, and plain old small intestinal bacterial overgrowth. And it's really interesting because once you treat the underlying root cause, as we try and do at our practice, you actually see them be able to tolerate dairy again. Now, should they really be eating dairy? That's a whole different question. It contains a lot of inflammatory agents, and maybe it's going to trigger some other kind of issue in this particular person who's prone to small bowel disease. But we definitely see that reversible sometimes when you actually reverse the underlying issue. So that's interesting. So if you guys are finding this interesting, please type it in the comments. Just type milk or type gut over it, right? We're doing a whole month of February, just talking about different GI issues, really focusing on symptoms that patients don't want to mention to their GI docs, but are important because they could help us with diagnosis and help you get better. So I'm going to talk about a question that patients always ask me. Usually when I tell them, I think you have lactose intolerance, they say, how are you going to prove that, Dr. V? How are you going to prove that? You want me to stop eating dairy for 2 weeks or 1 month or whatever. I'm not sure I can give up my cheese, my mozzarella, Parmesan, Gruyere, Emmental. I can't give it up. How are you going to prove? And so I say, well, do you want to do a lactose breath test? They were like, sure, let's do it. Let's prove it. I don't want to commit if you can't prove that I have lactose intolerance. So these are really the dairy lovers, right? So I'm like, okay, let's look at the instructions. So I brought the instructions because this is a question that my physician assistant, Donna, had. She said, well, should we even be testing people for lactose intolerance? Like, what's the point? So I said, okay, you want us to prove it, so this is what you have to do. These are the instructions. They have 6 little tubes. Okay, I did this myself as a test. Then you have lactose. You have the actual lactose. Ooh, so if you have intolerance, this is gonna make you feel bad. And so what they do is basically to do this test to prove that you have lactose intolerance, you can't take antibiotics for 4 weeks, no laxatives, you can't smoke or vape, okay? You don't sleep, exercise, or do any kind of other intercourse, right, for 1 hour prior to taking the test. Then for 12 hours, you have to eat a specific diet, baked or broiled chicken or turkey, eggs, white rice, plain coffee or tea, no milk, minimal fats and seasoning for 12 hours. After the 12 hours, you have to fast for 12 hours, right? So no eating. And then you wake up and then you you drink that little substrate once you've mixed it with water. Mix it nicely. And you must drink it within 40 minutes of, mixing it. And then every 40 minutes, you then blow air into one of these test tubes. every 40 minutes. That's all you have to do all day. I mean, that's you four sample collections, I think. Yes, every 40 minutes. And then you label everything and then you ship it to the company and then they send you results and they say you have lactose intolerance. So I did this test. They said I had lactose intolerance. Lies. Because I don't. I don't. I don't know. I have no issues with milk. I don't get bloated. And I sat there for 4 hours. I was in clinic actually, so my staff was testing me. I really like to do a lot of the tests that I give to patients so that I know how it feels, what they're experiencing. So just a little segue, I did my colonoscopy recently and I drank the prep. And it wasn't really that bad. It really wasn't. And so, I mean, I drank it like a champ. I guzzled all of it down and I was like, that's it? What are my patients complaining about? This is nothing. So now when patients come and like, I don't want to Dr. V, I'm like, I did it. It wasn't that bad. And they're like, you did it? I said, yeah, I did it. It wasn't that bad. But anyway, this is a lot of work. And I tell patients, do you want to do it? They're like, I don't know. So I said, why don't you just stop drinking milk for 2 weeks and let's see if that reduces the bloating, the diarrhea, the cramping, the acne, the eczema, the wheezing, the nasal drip, post-nasal drip. I mean, all of this could be related to it. And again, let me point out that you may do this test that shows that you don't have lactose intolerance, right? But maybe you have milk sensitivity, you have dairy sensitivity, and so you'll still have symptoms, right? And I also don't understand people like my husband, he's over there, but if you have lactose intolerance, right? If you have lactose intolerance and you know you have lactose intolerance, that kind of means your body doesn't like dairy, right? Your body will reject it. The body doesn't have the enzyme to break it down. Why do you insist on having ice cream? And then popping the lactate. And then, then there's expulsion of air, flatulence, because, why? If your body doesn't like it, don't ingest it. Don't put it in your body. Your body is rejecting it, So as a gastroenterologist, I don't believe in that lactate stuff. Just don't drink the milk. So let's start talking about alternatives, right? Because a lot of people think vitamin, calcium, and vitamin D, it's through milk. No milk. They're like, well, where do I get my milk? Where do I get my calcium, Dr. V? Where do I get my vitamin D? So if you can tell me, people out there, and it's so nice to see so many people, exciting. If you can tell me what other foods are rich in calcium or vitamin D, please go ahead and type it into the comments, please. Everyone, and not milk, right? But any other foods that are rich in calcium and vitamin D. This is just, we're just sharing information so everybody knows, because this is something people don't know. Type it in the comments for us. The more answers we have, the better. I don't want to give away all my secrets yet, because I want to see what everyone brings out. I'm going to talk about, so if you have, a lot of people will say that, well, I have dairy. I don't tolerate milk. But I'm perfectly fine with 8 cheeses. I'm okay with yogurt, cottage cheese. And that's simply because if you do have a lactose intolerance, the concentration in lactase in aged cheese and yogurt and what else? Yogurt, aged cheese. The concentration of lactose in those foods are much less. And so that's why you barely have a reaction. I actually saw that the concentration was, it was much, much, much less. And that's why most of the times you don't react to those foods, right? And so let's talk about some foods. If some comments have come through, but other foods that are extremely rich in calcium, beans and lentils, sardines, if you like sardines, almonds, and almond and rice milk are great alternatives. Tofu, pink salmon, a lot of greens. So spinach, collard greens, extremely rich in calcium, and seeds. So there are so many other ways. And these are not high in cholesterol. You won't get diabetes, okay, or cardiovascular disease. You want to purchase all of this organic, but you're not exposed to all those antibiotics and pro-inflammatory agents that affect you, right? And they're great alternatives. These are wholesome, rich foods, okay? And so finally, we sometimes talk about what other forms of milk can we have? And they actually say that the milk in goat cheese, in goat's milk and sheep milk is not as pro-inflammatory as cow's milk. So those are actually better options because the casein, as I said, there are different types of casein, and the actual casein protein is not as pro-inflammatory. So I hope this talk was helpful. I hope you've learned some great information. We talked about the two different types of milk issues, the food sensitivity, so the sensitivity to the actual protein, the cow's milk, casein essentially, and then we talked about the lactose intolerance, right? We talked about different options, different forms of high calcium and vitamin D foods to eat. And so I want to say good night. Cheers. Thank you for listening. Again, my name is Dr. Vivian Asamoah. This is sheep milk. Don't ask me where I got it. I'm a gastroenterologist in Katy, Texas. I'm welcoming new patients to my practice. I'm also a functional medicine provider, and I just love to learn, share, and entertain my patients. Have a wonderful evening. Bye.